In this presentation, we discuss iron and its direct connection to the neurological disease some of us may know as dementia. Iron is a crucial element of hemoglobin, a component found in red blood cells which is essential in transferring oxygen from lungs to the body and is the carrier of 70% of iron found in the body. Iron absorption occurs in the duodenum and proximal genome. Initially, iron is metabolized by the red precursor cells which then binds into globin chains to create hemoglobin. Iron is circulated into the blood and binds to a molecule called transferrin which carries iron through the body to the organs of the bone marrow at which red precursor cells await. Iron is also found in muscle cells called myoglobin which accepts, stores, transports and then releases the oxygen. The main labile form of iron storage is ferritin, which means iron can enter and exit this form quickly. Ferritin is a protein living in your body's cells released by the reticular endothelial system in which iron is stored into, releasing iron when your body needs it. As it is an acute phase protein, increased ferritin levels can be a reliable source of indication to chronic inflammation. Hemosiderin is the second form of iron storage, which is a more stable form. However, iron in this form is less accessible. Lack of iron may result in the depletion of oxygen-carrying red blood cells, meaning the brain and the entire physiological system will become ultimately exhausted. Think of it this way: oxygen is an essential factor to the survival of the body. Every organ, limb, tissue and muscle, every movement, thought, breath and heartbeat. A depletion or insufficient supply of oxygen to the body may begin to shut it down if left untreated, causing significant exhaustion and in worst cases potentially death. In a healthy person, the intestines act as a regulator in iron metabolism and only absorb the amount of iron our body needs from food, usually adding up to approximately 10% of the iron consumed. However, people that suffer from a condition known as hemochromatosis have the ability to absorb up to 30%. This condition not only results in dangerously high levels deposited in joints, liver, pancreas and heart, but also has been found to be associated with cognitive decline. Similarly, iron deficiency anemia victims can also be vulnerable to diminished cognitive function and were found to be at 40% higher risk of developing dementia due to a lack of oxygen-rich blood being transported to the brain. Dementia is an umbrella term used to describe varying progressive states and severities of neurodegenerative diseases. The most common forms of dementia include Alzheimer's disease, which has the greatest prevalence, vascular dementia, and dementia with Lewy bodies. Dementia in general terms describes the decline of mental capacity which can affect a person's memory, language skills, self-management, and attention span. This is due to cell death within the brain structures such as the hippocampus, the frontal cortex, and the temporal lobe. Key differences between a healthy and diseased brain include that the cortex has shriveled, which impacts the person's thinking, planning, and memory; shrinkage in the hippocampus, which is where long-term and short-term memories are retrieved; and ventricular enlargement, where CSF volume and pressure is affected due to the degraded ventricles. So how exactly does iron play a role in dementia? Studies have shown that high levels of iron overload in the brain may lead to neurological diseases additional to dementia, and rather than looking in the brain, researchers are now looking more into the blood for the link. To facilitate biochemical reactions, the body uses zinc, copper, and iron. However, these metals are not beneficial to dementia patients. 1 in 4 people over the age of 85 are positively diagnosed with dementia, and efficient iron metabolism plays a vital role in the aging factor of a human, which is a key influencer of the disease. As dementia currently has no cure, medications such as cholinergic, memantine, and the use of antidepressants have proven to have a reduction of symptoms of dementia, such as depression, anxiety, and aggression. In addition to this, other therapies include cognitive stimulation or behavioral therapies which aid in maintaining an active mind. Furthermore, the monitoring of iron accumulation in the brain is critical in decreasing disease progression and reducing the effects of the disease on the brain's signaling systems. Iron transfusions or blood filtering can also be conducted on iron deficiency or hemochromatosis patients. In order to get a better understanding of how iron metabolism is linked to dementia, medical professionals have concentrated their research on transferrin and discovered that lack of efficient iron circulation may create an iron buildup and plaques in the brain, causing serious implications on the transmission of brain cells essential to cognitive function. Doctors at the Florey Institute conducted a research project sampling blood of 34 dementia patients and 36 healthy participants. The samples were taken to AIBL, who analyzed the blood samples over a period of 54 months and found that the amount of iron carried by transferrin was low in dementia patients, supporting the hypothesis. For further understanding and control of the disease, scientists aim to look into copper-binding protein called ceruloplasmin that interacts with transferrin. This further research will aid in maintaining quality of life, delaying the progress of dementia, and hopefully finding the cure for the silent disease in the future.